Attention nurses, are you a nursing student? Have you been stressed recently? Have you been neglecting your health? Have you been eating a little bit too much Chick-fil-A? Let me try and help you by teaching you more about caring for your body. I want you and I to work through barriers you are facing while in nursing school while practicing daily health promotion. I want you to improve your exercise routine. I want you to improve your diet. And I want you to feel comfortable in your own skin. I want you to be the healthiest nurse you can possibly be. I'm going to give you these flyers. Hello, my name is Nicholas Jones, and I will be focusing on caring for body. I will be teaching this to Andrea Rodriguez-Jones, Zachary Scott, and Candace Cummings. The reason why I picked my audience is because I feel like nursing students may neglect their own body. I will teach them about maintaining an exercise routine, increasing healthy dietary habits, and avoiding anything negative to put in your own body. I will also explain that a workout routine can be something fun for you, and it shouldn't just be work. It should be something that makes you happy to do. I look forward to your response on my topic, and I hope you guys enjoy my discussion. This topic is important to me because I've had a previous weight loss journey. At my highest, I weighed 300 pounds, and I lost 115 pounds. But I know how difficult it is to maintain your weight during nursing school. I wanted to use the rising obesity rate in the nursing field. I wanted to discuss how going through a difficult job, nurses turn to food for comfort, and also at times have a stressful job. Nurses can forget to properly take care of themselves by going to the gym. I feel like these things can also affect a nurse's mental health. Not only having such a difficult job can affect your mental health, but lack of taking care of yourself physically, I feel like can translate over to affecting negatively. I feel like as nurses, we handle so much in our role models, and I feel like as role models, we should be examples to ourselves. So I'm gonna put that here. Previously, before talking to you guys, I feel like you guys are in the pre-contemplation to contemplation stage. I feel like I can change your guys' opinion after this presentation. I'm very excited to present my project because I know it has made a change in my life, and I'm excited to see what it can do for you guys. I'm going to give you guys your feedback response forms. So what I'm using is the problem statement and purpose. The prevalence of obesity in U.S. adults is 39.3%, and rates of non-communicable lifestyle diseases such as cardiovascular disease and type 2 diabetes are an epidemic. Despite nurses' training and role on the front lines of treatment and management of lifestyle-related diseases, nurses in the U.S. experience prevalence rates of obesity that range from 23% to 61.4%. The problem is not exclusively a U.S. phenomenon, as the prevalence of obesity in British nurses is 25.1%, similar to the 27% found in the general population of England. Nurses may not be participating in health-promoting activities such as exercising, eating a healthy diet, and practicing stress reduction activities. In a review of the 13 most large-scale studies that examined physical activity levels and diets of U.S. hospital nurses, the majority of nurses reported that their diets were of poor quality, 53% to 61%, and that they participate in inadequate levels of activity, 60 to 74% of them. Because of their poor diet and low level of exercise, nurses are at an increased risk for chronic disease, which in turn can lead to higher levels of absenteeism and turnover. Indeed, poor health is one of the primary reasons why nurses intend to leave the workplace. Nurses' health status and rates of participation in health behaviors may influence both the nature and quality of patient care. For example, nurses who exercise regularly are more likely to encourage their patients to engage in physical activity. Conversely, overweight healthcare professionals may be less likely to provide weight loss advice to overweight or obese patients than would their normal weight counterparts. Nurses who do not exercise are more likely to experience lower back pain, and nurses with low back pain are more likely to provide compromised patient care, including medical errors and increased rates of patient falls. A healthy nurse workforce is a public health priority. Numerous studies have described the high prevalence of overweight and obesity in nurses. and others have focused on the quality of nurses' diets and or their levels of physical activity. However, less fit research is focused on why nurses might not be engaging in health-promoting self-care. In order to improve nurses' health status, a more thorough understanding of the factors that influence nurses' participation in health-promoting behaviors is warranted. The purpose of this study is to describe nurses' perceptions regarding factors that influence their participation in health-promoting behaviors, such as exercising, consuming a healthy diet, and participating in stress reduction activities. What I would like to try to teach you guys today are three things: a calorie deficit, building a workout routine, and intermittent fasting. A calorie deficit is how many calories are you eating in a day. A calorie deficit simply means you're eating fewer calories than you're burning. People use calorie deficit to lose weight and maintain weight loss. You can use a food diary app to record what you eat and how many calories you consume over a week or two. I personally use the app Lose It. How many days are you working out? You're supposed to be working out 150 minutes of moderate aerobic exercise per week, or 75 minutes of vigorous aerobic activity. You're supposed to have 2 or more strength training sessions per week, with at least 48 hours in between to allow muscles to recover. Remember that working out should be fun, so do what is fun and enjoyable for you. Try taking a class so that you have people to encourage you, and also it can build a community that hold each other accountable. The most important thing is intermittent fasting. The idea behind intermittent fasting is that by restricting food our bodies will more quickly and efficiently tap our fat stores for energy. While glucose from carbohydrates is our most direct fuel source, we burn fat for our energy when glucose isn't available. This happens even during times of food deprivation. The practice of 16 hours intermittent and only eating 8 hours of the day. Intermittent fasting involves limiting your intake of foods and calorie-containing beverages to a set window of 8 hours per day. So you only eat for 8 hours. You abstain from food for the remaining 16 hours, though you're still allowed to drink water and other no-calorie beverages like canned coffee or tea. My SMART goal is I hope that you guys will be able to verbalize 2 methods used to lower BMI through working out and proper nutrition by the end of my presentation. Can I see that? This one. Before my presentation, how often did you work out during the week and how was your diet? Are you currently happy with that? After listening to my presentation, what do you plan to do? What do you hope it produces? And what are the steps to educate and the steps to monitor? What do you think you learned from my presentation, and do you think that you will try to apply this to your own life? And what about my presentation do you disagree with, or what do you think you could teach me so I can improve my project? Thank you, Andrea Jones, Candace Cox, and Zachary Scott. That was my presentation.